No matter what's going on in our hospital, no matter how busy it is, we are always concentrating on infection prevention. September is Sepsis Awareness Month. The term sepsis is a term that we use to describe the body's overwhelming and potentially life-threatening response to an infection. Sepsis is the #1 diagnosis that we see here at Kaweah Health. There's a lot of symptoms, but the most common is if your patient has an elevated respiratory rate or heart rate, or if they have a spike in their temperature, which is also known as a fever. Some other common signs and symptoms include confusion, generalized weakness, lethargy. Even though that there is a pandemic going on, our staff are more than knowledgeable and adequate to meet the demands of what a septic patient needs. We do have a sepsis committee that is led by our medical director of quality and patient safety, Dr. Tom Gray. That sepsis committee is comprised of physicians and nurses, and we all collaborate together on a monthly basis to make sure that all of our sepsis care is state-of-the-art and up to date. Our sepsis program was ranked top decile in the nation among sepsis care. For that to happen during a pandemic year is very exceptional, and is something that myself and our sepsis program are very proud of. The gold standard of sepsis care is early recognition, early antibiotic administration, and early fluid resuscitation. And I've seen it in our emergency department where people come in a little bit too late and they are very, very sick. In the most severe cases of sepsis, it can be very detrimental to your overall health well after your diagnosis has been treated. Even though it can happen to anyone at any time, there's a particular risk of the 65 and older population, especially those who are currently living with a pre-existing medical condition, such as diabetes or renal disease, that's kidney disease, or cancer. And there's a special concern for those who are living with some sort of catheter, or those who are living with a chronic wound or skin ulcer. The most important thing that the community should understand is how important it is to wash your hands. Make sure that you and your loved ones are updated on all the immunizations and vaccinations that are available to you, including the COVID vaccine, flu vaccine, to not only bolster your immunity so that you can fight a future infection, but also helps prevent the spreading of other diseases. If you have a primary care provider, get an appointment set up with them if you're just not feeling well, or you can also visit any of our 5 rural health clinics in the county, and they can get anything that you need. If there is an emergency, please come visit our Kaweah Health emergency department so that we can get you treated, because early recognition and treatment is vital to success.